Welcome to the Psychology Talk podcast. We are your hosts, Dr. Scott Hoye, clinical psychologist,
and Kyle Miller, licensed counselor. Psychology Talk is a unique conversation about psychology around the globe. We speak with psychology experts to keep you informed about current issues and trends. We advocate toward reducing stigma and educate about mental health.
While you're listening, please take a moment to give us a review and subscribe on Apple Podcasts, Spreaker, or your favorite streaming service. It helps us to continue providing you with quality programming. And now, enjoy the episode. Hello, everyone. Welcome to the Psychology Talk podcast. I'm Dr. Scott Hoye. Today, my guest is Dr. Caroline Carney. Dr. Carney is the President of Behavioral Health and Chief Medical Officer at Magellan Health. She's here to discuss the effects of the COVID-19 pandemic on the mental health of children and how behavioral health professionals can guide parents to help their children cope and manage their emotions as we enter the third year of the pandemic. Dr. Carney, welcome to the show.
Thank you so much for having me on today. You are doing great work by bringing this kind of information forward. Thank you.
Well, thank you for coming and sharing your vast knowledge on the subject. So maybe what we can do to get started is you can kind of introduce yourself a little bit more, if you like, maybe your background, how you got working with Magellan, and particularly what you do.
Sure, thanks. I am an internist and a psychiatrist, board certified in both specialties, Scott, and I have always believed in taking that integrated view of an individual and their healthcare journey. That view includes not only their behavioral health and their physical health, but also the social circumstances in which they live and the food they eat, the exercise they get, the sleep they have, the whole component of making really whole person care. And there has never been a time more than the pandemic that calls into focus all of those kinds of components we need to stay healthy as children, adolescents, adults. My background as a psychiatrist and an internist is a bit mixed. I was an academic physician and researcher for a number of years before venturing into managed care and into the policy world through state Medicaid office. I made that change because I felt like in these roles we could help change the lives of thousands at a time, hundreds of thousands in some cases, as opposed to one patient at a time, by really getting to patient-centered, member-centric kinds of policies for healthcare. I'm also a mom of 3, and that has influenced how I look at what's gone on during the pandemic with 100% certainty. I've seen what, my family and the families of so many others have experienced. In providing that kind of personal view, one needs to look at data and look at interventions. And then finally, I still practice in a federally qualified health center where I'm a medical director for a group of clinicians who are frontline in taking care of the behavioral health needs of adolescents and adults throughout the pandemic.
Wow, that's quite a bit. You have 3 children. What are their ages and where are they at in the lifespan?
So I have a son now in grad school, a daughter in undergrad, and a daughter in high school. And all of them missed some significant life events related to COVID.
Well, tell us a little bit about that. I mean, I think everybody kind of has this a bit of a perspective on how across that age span, that part of the lifespan, things are affecting people. Maybe even talking a little bit about how high school might differ, like from public schools might differ from undergraduate and graduate training.
I'd be happy to talk to all of those. I'll start with my son, who's the oldest. He graduated from the Honors College at Arizona State University, where he was Dean's Medalist in his field. He didn't get to go to graduation. There was less than an hour-long ceremony, and it was all through Zoom. And that was the extent of what happened for the culmination of 4 years of a lot of hard work and energy being put into his degrees. He had been accepted into graduate school, but it was clear that he would move to another city in another part of the country and live in a dorm room or an apartment to attend grad school online all year. And the field he was going into was one that's heavily dependent on interacting with other humans in a very personal way in part of what he's doing. And so he deferred for a year. And I call this a traumatic growth experience for him. He would say, "Oh, Mom, don't talk about this, but I will." He ended up working as a floor supervisor at UPS, overseeing men and women who were loading trucks all evening long, working from 5 o'clock at night until midnight most nights, in the heat of Arizona without air conditioning, on teams that were ensuring that we all got all of the shipments we ordered and were delivered through UPS during that year that he deferred from grad school.
Wow.
I think that gave him experience like nothing he could have had otherwise, and really set a stage for understanding the expanse of experiences that folks who are doing work like this all day, every day are living, compared to someone like him who could have gone straight from college to grad school into the workforce at some point in time. And I think it was a huge, huge growth experience for him. So out of loss of some of the normal events that would have marked his life, he had this incredible experience that I know as he reflects back on it, he's recognizing more and more what actually a gift that was.
Yeah, no, it sounds like he took a gap year, but but more like a pioneer experience gap year, if you will, or a warehouse gap year. But I think I would agree. I think that an experience like that, working with a lot of people who may never go on to graduate school, it gives him, not to say that I'm a mind reader and can say what his interactions were with people from different social economic statuses, but it probably opened up his mind in a lot of ways.
It really did. And he has stories about that really, I think, influenced him. He had a young man, 18 years old, who was working full-time to provide for a wife and 2 children at the age of 18. And wow. That, was incredibly enlightening and sobering all at the same time for him, because of seeing into how hard some people are working to make it work for their families and to grow a family even at such a young age. He saw a lot of folks with turnover because of the pandemic and people getting sick and not being able to continue to work, and saw others who had friends and relatives who died during the pandemic. So that whole experience, incredibly formative in a young person's life, and one I know he'll carry with him. So I think the best example of post-traumatic growth that could have occurred.
Yeah. And so now he's going to be doing school next year, is that right?
He's in school now. Yeah, he deferred that year of 2020. So he's tucked in the cold of Chicago as we speak.
Oh, okay. Another Chicago person here. Okay. Yeah. Yeah. So he knows what we're going through right now. Maybe you could speak to your other children and what their experience has been because of the pandemic.
So the other experience, I'll talk more briefly about my daughter, who is the middle child. She was at school and moved from a year of being in the dorm and active on campus to having everything quickly shift to online. She's an actress and had her first main stage leading role at the end of her freshman year on the stage, the full kind of production, and won the lead role for the fall production, main stage production at her college. And that was all done online. So a conversion of being a stage actress to doing a play over Zoom in an incredibly creative way that they tried to do it, but definitely not the same experience. In that play, her character at the end commits suicide. The next play for the spring semester, the same thing happened. And at the end of that play, same thing, in Zoom, her character committed suicide. Now, I have to put this in context because instead of being together as a group, each of these kids either practiced from home or their dorm room, or if they got to be on campus, they were in a green room all by themselves. And so night after night after night, she was playing these two women who commit suicide during their time and had no support. There was no director, there was no stage manager, there was no cast next to you. It was night after night of doing these kinds of roles in the isolation of your own room and maybe with your roommates who, may or may not understand what this is all about. So a very different kind of experience.
Wow.
So that was something that really kind of turned her life upside down in such a way that the thing that she loved to do the most, which was be on stage and act, dramatically got transformed into the different style. But I think what it spoke to was that more imminent need for the delivery of behavioral health care to teens, adolescents, 20-somethings, whose lives really did make that dramatic shift from where they thought they were going to where they actually were during the last year and a half. And out of that, she was able to advocate for getting services for kids who were in the arts. So if you were on a basketball team, you still had your personal trainer and you still had physical therapist and you had those kinds of services available. Not so much for kids who are in the arts, whether they're musicians or print artists or actors.
That's very true. I spoke earlier in the month to an actress who was finishing up her psychology degree at the Wright Institute and acting on and off during the pandemic or I think the pandemic hit right as she was graduating, but she works extensively with people, specifically, and we discussed how in general the performing artists have been really affected by this. As a former actor myself, I find it odd that the students weren't directed and didn't have some kind of mentorship.
There was a director, but he also directed from home. And there wasn't, I have been an actress in the past as well, so we share that, Scott.
Oh, okay.
So that's a team sport. Acting is really a team sport. And a lot of folks who don't do it don't quite understand the nature of the cast and how the cast becomes a family and
absolutely
a system of support. And so in the case of this, it was rehearsals over, turn off your camera and you're done for the night. And it was, that was the tone that was set during one of these experiences.
Wow. Yeah. Okay. Thanks for clarifying that they had the director, but the director was probably also the director/professor was also going through their shifting into working in isolation. Yeah.
Absolutely.
Well, what about your daughter in high school? How has this affected her?
So that was also an interesting transition. She went from basically a semester in freshman year and then straight to Zoom and they came back, I think, from fall break and never went back to online or in person rather for the rest of the year. She had challenges with that, not academically. Everything, was fine academically, but it was the estrangement from being with that cohort of kids, and being able to joke and laugh and sit down with your friend for lunch or see them after school at extracurricular activities, all of that social kind of activity shut down. The kinds of things that would have been those rites of passages for some kids, like getting to go to prom, getting to go to the high school graduation of your friend who was a senior, those kinds of things. All of that shut down. The second thing that happened was in our community, there's a pretty vast difference of opinion about masking and COVID versus not masking, and there's no such thing as COVID, and a lot of the kids were caught at the crosshairs of that.
I think that's kind of almost a universal thing for most communities, and people's opinions widely differ, I think, depending on whether or not their lives have been touched by the pandemic in some way, shape, or form. I think I don't have the statistics, but I would assume that's a contributing factor to it. The unfortunate politicization of things,
right?
Everything, not just the pandemic, but everything is politics now for some reason,
right? And so we have, kids who are caught in the crosshairs of that, not necessarily knowing if it's the right or wrong thing to do to wear a mask. And if you came from a household like mine, we wore masks. We wear masks, and she wore a mask to school. And depending on the class, after they did go back, some teachers did, some teachers didn't. It was a mix, and I think that's pretty confusing for kids to navigate. The second is just there was fear among a lot of kids about, okay, I'm going back. I don't know if it's safe or not. We're being told to wear masks, but when we're in the hallways between classes and it's super crowded, no one's wearing a mask, and am I going to get sick? And she was still at an age where vaccines hadn't been approved for that age range yet. And so there was, I think, even more fear, just in terms of, am I going to be okay? It's also challenging, I think, for kids who are of her age and younger, especially, who may hear a snippet on the news or a headline about the number of deaths or the number of cases, and not being able to interpret those kinds of headlines to their own life. And so that fuels anxiety often.
Mm-hmm. Right. So as we've kind of progressively gone further back in age, historically, ages, and how have you seen it roll out as a mother and a behavioral health specialist, psychiatrist, and someone involved in public health policy, right, and influencing that and working clinically. Maybe this is a good way to kind of like step back even further to how children might be affected by it, if you think you'd like to do that.
Yeah, absolutely. So the first thing I would say that this problem is paramount in the United States, but this is a huge global problem for kids all across the world. UNICEF did a study with Gallup looking at 21 different countries and found that 1 in 5 young people aged 15 to 24 reported either feeling depressed or having little interest or pleasure in doing things, those first 2 screening questions for depression. So 1 in 5 across these 21 different countries. So very pervasive in how this affected kids across our globe. About 1 in 7 of that same group had been affected by lockdowns in one way, shape, or form. And another big number of these kids suffered some loss of education. So in some cases, if school shut down, if things stayed stagnant in their education and they didn't keep growing like they might have if they had been in-person classes or if their schools hadn't shut down completely. So that's kind of one factor, is just, was there an environment where kids could go to school? And if they went online, was the online experience the same? Was it still going to get them to where they needed to be? And I think there's a lot of mixed results about that, depending on the school systems that kids were in and what the districts did to try to normalize things or hold standards up as high as they possibly could. My daughter would report that she would get on some classes and see kids still in their beds, not just sitting on their bed, but in bed with a camera turned on and completely disengaged. So keep that bucket in mind. The second bucket for kids is a bucket of grief, with a substantial number of kids, into the tens of thousands in the United States, having been affected by the loss of a custodial parent or a custodial caregiver, whether that was a grandparent or aunt or uncle or something. And so the amount of grief complicating this was huge. The third bucket is the things that kids may have been exposed to during the pandemic, the sorts of things like seeing mom or dad at home having lost their job, or mom or dad or caregiver at home having had to transition from offsite work to setting up a desk somewhere in the house for them to do their own work while they were trying to monitor and ensure that the kids did their own work. At the same time, this is going on during the pandemic, we saw the rates of alcohol use and abuse markedly increase. And so kids were exposed to this. They were exposed to seeing the downside of having depression and grief and loss in their parents or caregivers, influencing what their own mental health would have looked like at the same time. There was also an increase in violence toward kids and physical abuse toward kids during the pandemic, according to a few studies done. And then finally, there was the loss of all of those normal kinds of activities, the ability to either go out and socialize, go to a movie, be part of something at school, or even being on a sports team and maintaining physical activity and exercise that's so critically important to the growth and development of kids. And so if you look at all of these different inputs, it's not surprising to me that we've seen those statistics of 1 in 5 kids being affected with depression and a similar number with anxiety.
And as a psychologist myself, my mind goes to two things. When you hear about statistics about domestic violence on the rise, it's not just spousal violence, it can be in general across the board because of everybody's increased depression and anxiety and those proclivities. And some people with the proclivity to be violent might be even more so.
Right.
And they're isolated, so that can be problematic as well as boosting those factors. But what I'm thinking is the pandemic has set off a tsunami of adverse childhood experiences. Mm-hmm. And the further back, oftentimes the younger that those experiences start, the more those will be longitudinally, across their lifespan, affecting their mental health, their physical health, their social functioning. Are we looking at, this is maybe a little bit out of our wheelhouse or our ability to look in our crystal balls, but can we expect more mental health issues as these people age, and the need for more behavioral health and mental health support for them, and more issues of physical health that are comorbidities with these adverse childhood experiences?
So we don't have enough long-term data yet to show that would be the case. And I think the real question that we're looking at is, did kids get back in school and get to a, quote, normal life soon enough that many of those experiences will be reversed? Mm-hmm. So I would like to look at it in two ways, just from a broader epidemiologic point of view. Mm-hmm. The kids who lived in circumstances where there was suffering, where there was abuse, where there was increased alcohol use, decline in education, and that doesn't get turned around, I think we're absolutely looking at a downstream problem of a cohort of kids having continuing mental health issues and their own substance use issues throughout life because of the more chronic exposure to what this may have kicked off or triggered for them. I think others who were in families who were able to remain resilient and look at this as more of, while not normal, a normalizing circumstance across your demographic, across your classmates, across what other families or friends were dealing with, so that there is the ability to commiserate and understand and be a little bit more resilient in terms of how they were able to roll with some of what happened during the heights of the pandemic. Those kids will likely have a better outcome because of that resiliency and because they had support and structure around them.
Correct.
I think these months coming back to school, as kids are mostly back in school now, are really going to be so critical into how quickly we get back to what was pre-2020.
Okay, good. I hope
pre-2020, you have to be fair and say pre-2020 rates of suicide and mental health needs for kids were already on the rise prior to the pandemic.
Okay. Well, what do you maybe we can look at that. Why do you think those rates were on the rise prior to the pandemic? Is there any etiology of that, any source of that?
Sure. A lot of what has been looked at in that area is the influence of social media, the changes in family structure dynamics, two parents working, homes that were maybe under stress from socioeconomic issues coming into the pandemic, the general kind of discontent in society that we referred to earlier, a lot of different factors. But one that's been implicated over and over again is the influence of social media and living life on your phone. That really helped, I think, fuel some of what we were seeing in the development of symptoms in kids.
Okay. And then talk a little bit about the incidence of suicide attempts and the unfortunate completion of suicide that has happened amongst children and teens since the pandemic started.
Since the pandemic started, the incidence of kids going to emergency departments for suicide markedly increased. In 2020 compared to 2019, there was an increase of a little over 30% of increase in visits to emergency departments for suicidal ideation. That's a big number when you think about it, a really big number. But in subgroups of that, it was even worse. So for young girls, which had been a demographic that hadn't been as influenced by the suicide risk, in February and March of 2021, for girls between the ages of 12 and 17, the increased visits to emergency rooms increased by 51%.
Wow.
So really critically affecting a group of young girls.
That is a huge number. And probably largely because there is even more social isolation, right? And more use of social media as a connection with other people, which is not the best means of connecting with people.
No, and while you had to be a proponent for using social media for some of that connection, to have so much of it just shift to that. And the world of social media isn't real for kids. We have learned now what tactics are being used by Facebook, Instagram, kinds of things that have fueled the incidence of eating disorders in girls as well. The changes in body image, the filters being used, the perception that everyone is happy, or the bullying that gets done. The tool, while there are absolutely some positive aspects to it, there are a lot of damaging aspects. And in cases where it may have been more challenging to really monitor and confine the use of social media in kids during the pandemic, it's really blossomed.
Yeah. We could even have you back just to talk about this, I'm sure.
Yeah.
I mean, I could bring many people back, but you'd certainly be an excellent person to talk about this maybe at some point, just the social media aspect of things. Well, this all sounds very grave, but as a behavioral health expert, I know that you have our work is to help people find some hope, give suggestions for ways they can handle things, maybe systemically or socially or within their own home units. Maybe one of the things we can look at is we can address what parents might look for in their children.
Sure.
And to see if they have any mental health issues that might be blossoming in them.
Before I would love to talk about that, I want to say one thing about the increased emergency room use.
Okay.
Which is the opposite of a dire picture. It also tells me that there's better awareness of help seeking and parents and caregivers being engaged with their kids to get them to the emergency room to understand that something is wrong. And I have a child who could come into harm's way. And so the numbers increased, but maybe that's a good thing that they increased instead of having events happen and terrible outcomes happen because parents didn't think that there was a place to go for some help. The numbers are terrible. I'm not diminishing that at all, but I am at least trying to put a little bit of silver lining on that black cloud by saying kids got services and maybe emergent, but they open the door to get services that may have been needed.
And when you look at statistics, you can read them. There's a lot of interpretation from statistics. We know the bare numbers, but you reframe that really elegantly in doing that. I mean, it's obviously I'm distraught when I hear that young adolescent females are.
It's awful.
It's terrible, but it's good that they're also seeking out. They know that, and maybe that's. I know there's a lot of influencers and advocates for mental health on social media, so maybe it's okay not to be okay, even more and more, which is good.
The things that parents can really look for in their kids are prior to pandemic, during pandemic, post-pandemic, the same kinds of things happening. So a change in that usual activity that your kid may have done or been interested in, the withdrawal from being part of a group, part of friends, active with family, doing their favorite things to just withdrawing from those things that brought them pleasure before. A loss or perceived failure of achievement. So the kid who thought they were going to get into this college and didn't, the kid who thought they were making straight A's and didn't, or were getting to be first string and didn't, that kind of perceived failure on kids, they can take very, very hard, that you or I might say, in the long run, not going to matter. At that point in time, it hugely, hugely matters to the adolescent at that point in their life. If we start seeing a decline in grades, an increase in self-deprecating behavior or hopeless kind of behavior, like, Mom, this is never going to get better. I am never going to have a good job. The sorts of hopelessness is such a harbinger of that kind of thinking of depression and potentially suicidal ideation. A kid who starts using substances who hadn't before or is increasing in substance use is a big one. And kids who are talking about suicide or looking into it on social media or searching the web, those are all warning signs we really need to pay attention to.
Okay. And maybe twofoldly, you can think about, speak to what behavioral health specialists can do to help kind of build more stable environments and add support for children as this continues. I mean, certainly I hope the epidemic disappears, but I don't think that's going to happen anytime soon. I think it's going to be a slow pace. People like Michael Osterholm and others, when they have a very, very sober assessment of things, it seems like this will be with us for a couple more years with variations of mask mandates and whatnot, and need for more inoculations. But what can we do as behavioral health specialists? What can I do? What can my colleagues do? And what can parents do to help provide more support and sustain our families and our children?
So at a family level, it's having those open discussions and it's engaging. It's having your kids put away the phone and you put away the phone and having time to really connect with one another so that there aren't the distractions of whatever is happening in social media and the instant gratification, but really focusing on each other. The second is to talk openly about your own feelings on the pandemic or frustrations that you might have, to open up the dialogue for them to be able to share their frustrations. The kind of stiff upper lip and it's all going to be okay and you'll be fine doesn't work in kids. They want to be heard. And so sometimes an entree into that is to say, yeah, I had a lousy day. I was on Zoom for 10 hours in a row and I missed people. How are you feeling about this? What's to just give an entree to the child to be able to openly talk and to not criticize what they're saying, because we were kids once too, but we were never kids in the same set of circumstances that these kids are living through today. So opening and listening without judgment. Outside of, and then of course, paying attention to the signals that I talked about. If there is a developing mental illness, learning how to recognize that and seeking resources, whether that's through your primary care doctor to start with or going straight into a behavioral health care system, trying to seek services to help put the protection around your kids. From a more community space, Scott, I think we have to serve as leaders in our communities. We have to be the voice at the school who says, if there was a suicide in our school, we need to talk about it. We need to do crisis management around it. We need not to brush it under the rug, but to do the kinds of tactics that help support schools and counselors and teachers in doing the right kinds of interventions for kids in addressing mental health. To make it normal, to make it destigmatized, to make it real, and to be honest about it. There was a suicide in my daughter's school at the beginning of this school year. And I think the school did a terrific job in how they handled it and brought resources into the school for kids. But a lot of kids, for some period of time after, suffered. And I would hear my daughter say, so-and-so's mom and dad said, it's over, it wasn't your problem, just move on. And that's not the way to handle it, right? So being able to give parents and teachers and administrators the kinds of tools that they need. I think breaking that silence in our communities by saying it's okay to seek services. It's no different having depression than it is having, name your medical condition. It can be treated. It's something we need to do. So bringing kind of that evidence forward in the compassionate way. On a broader level, a more state, federal kind of level, is helping states determine where and how they might use the dollars that are coming from federal programs right now. So there have been dollars that have come in through the Emergency Rescue Plan Act and the Elementary and Secondary School Emergency Act. There have been billions of dollars poured into communities through these acts. Mm-hmm. And working as a community leader, working as an expert consultant at your state legislature to help define and guide where those dollars may go. And maybe you do that through NAMI. Maybe you do that through a school board or something. Maybe you do it through your professional association. But being a voice to help determine where those funds go and how those funds get spent. And then finally, being the apolitical voice in the room. It's hard. We're pulled, in all directions by neighbors, families, friends, whatever it might be. But I think as clinicians, at the end of the day, it is contingent upon us to be the apolitical voice in the room.
Yes, and that is very hard to remain objective sometimes, but it's super important, especially in a public service method. Yeah. How is Magellan handling all of this? I don't know if you wanted to speak to a little bit of that and maybe
Sure.
talk a little bit about Magellan as an entity.
Yeah, I'll start kind of like the family level and work my way up. So
Okay.
As a family level, our teams really pulled together to provide resources in the terms of, whether it was a monograph for someone to read, whether it was giving webinars and podcasts much like this, but directed specifically at our own employees to provide them the kinds of tools that might help for them. Opening access to tools for mindfulness activities. Encouraging our employees to use their EAP resources to get into counseling if needed. And we brought on an online counselor to ensure that people could more quickly get into those services instead of waiting for someone in the community, which, as you know, that burden of wait is huge for everyone right now. So we brought in those sorts of resources for our employees. We lengthened the time that people could be away who had COVID so that there wasn't this pressure and rush to come back to work, that they could have time to be well. We quickly transformed our company into almost entirely virtual. We had been almost all virtual before, but at the first part of 2020, we moved the rest of the company over and helped provide tools and resources for them. We allowed folks to come back into the offices and get their stuff so that they could, have some of what was theirs in their new space. We became more flexible as leaders. If we knew there was a young mom at home who had to, spend however many hours paying attention to the kindergartner and second grader on online school, that if she needed to shift her work forward and do some of it in the evenings, that was okay. We did all kinds of fun activities over Zoom to the best that we could in terms of team building exercises. And then we had some serious talks about things like suicide. I did a webinar with some of our leaders. It was the highest attended webinar ever in Magellan's history. And the topic was about suicide. And we had some of our psychiatrists and counselors speak. After that was completed and, we signed off, the next week, I had 6 or 7 different employees reach out to me directly to share their own stories about what had happened inside their own life experiences with suicide. So having that kind of connection, and I think the voice of authority from the scientific point of view, but compassion at the same time, was really critical to our employees. We're still struggling, like every other company is, with when's the right time to open up the offices fully again? When's the right time to say no restrictions on travel? I think a lot of us were almost there before Omicron hit, and then Omicron hit, and that kind of kicked the can down the road again. But our HR teams are working very diligently in trying to balance the safety aspect against the kind of sanity aspect of getting to do your job again in the same way that you used to get to do it before. Mm-hmm. So that was kind of at that level. We did a lot of those things. From that broader level, Magellan as a company opened up crisis lines at various points when different states were facing crises. For instance, right now we've opened up a crisis line in the state of Idaho, which is one of the states really being horribly affected by the pandemic still. And so our LCSWs and our call center will take calls free of charge to folks who are using the crisis line. They don't have to be a Magellan member or employee. You could call up and use that crisis line if you needed to. So we've done that in the face of some of the natural disasters that have occurred in the middle of the pandemic to allow people to have a resource that they could have at the touch of their hands. We have done things like this where we can help get the word out about what to do. And we have advocated at the national level time and time again for the kinds of dollars to go into the behavioral health field that are now being routed in that direction, and have been outspoken on issues related to stigma. Mm-hmm. One of our really successful programs for kids is called My Life. And My Life used to be an event where kids could come gather and learn about a mental health topic of some sort. We switched those to Zoom, opened up the platform for more kids to join, and successfully continue to offer those services to children and adolescents to participate in that program.
Yeah. Wow. Oh, well, your work sounds phenomenal. I'm sure that there's days when you wake up and go, wow, I have a lot on my plate. But then there's probably other days where you say, I've done the best I can, and we're really working in the direction of destigmatizing mental health issues and helping to bridge the gap during the pandemic for a lot of people. It's overwhelming, isn't it?
It is.
This is what we're going through right now for everybody.
Yeah. But there is that glimmer of hope that keeps me going. The overwhelming nature of all that the pandemic exposed, it was time. I'm sorry, that it took a pandemic to have to expose all that we need to do for mental health, behavioral health in our country. Yeah. But it's now, the momentum is there, and the time is now to really use that momentum to bring the right kinds of services and solutions to people.
Yeah, absolutely. I agree. So that's the positive frame of reference for it. And also a lot of the technologies that we had at our avail that we weren't really using. The potential was there, but such as this interview, doing this on the Zoom platform, or working though isolated, not so isolated, and being able to attend to our health while continuing to earn for our keep for our families. Some of us who are lucky to do that. Yeah.
That's right.
Yeah.
And I think one of the things that I have tried so hard to impart upon my own kids is being cognizant of those who can't do what we can do. Those individuals who, during the height of the pandemic, particularly our healthcare workers and other frontline workers who were putting themselves in harm's way every day, being cognizant and thankful that there are individuals out there doing that kind of work.
And they are still doing that. Healthcare workers and other frontline workers. And your son, kind of bringing this back full circle. Your son got an immersion in that world.
That's right.
Yeah.
That's right.
Yeah. Well, I think we should probably wrap up here. Everything we talked about was wonderful. I think that you enlightened us in many areas, Dr. Carney. And I would just like to ask if you have anything you'd like to add, and then we can probably sign off.
Again, my thanks to you, Scott, for doing what you are doing to help get the message out and to bring that science and expertise from all the people that you have been working with in your podcast out to the rest of the world. So thank you so much.
Well, thank you. I feel like it's a public service that I do, and I appreciate your appreciation. Thank you so much.
Thank you. Have a good day.
Thank you for listening to the Psychology Talk podcast. This podcast is intended for informative and entertainment purposes only. If you need a mental health professional, please seek one out. All material, copyright, the Psychology Talk podcast. Music is provided by the oddly Italianate named band Serenati? Ciao.